Thank you for staying with us. Just as we've seen for the past 3-4 days or thereabouts, it's been about the announcement of the passing of former President Muhammadu Buhari, the burial plans, the journey to London, the journey back to Nigeria, and the journey to his hometown in Daura. Yesterday, the man was laid to rest amid, pomp and pageantry. I like to say that. He lived quite a very long life. And many persons have described Buhari as a fulfilled man, at least by his own standard. He has been in the corridors of power for long, 83, 84, thereabout. And then 84, 85 rather, as military head of state. And he came in 2015, left in 2023. And then he has retired privately to himself and passed a few days ago. Now, the honors were given to him. The president was there from different head of countries and nations were represented. The Nigerian political space, they were there, the family, and you could see in some of those pictures, the family missing their loved ones and all of those things. But in the middle of all that, why all this was going on, like a day ago or so, when Femi Adesina, media assistant to President Buhari, while he was in power, two of them actually, Femi Adesina and Garba Shehu. So, that's Femi Adesina, while reliving the experiences and his relationship with his late boss, talked about the issue of his medical trips abroad, especially in London, and how, the man had to just take himself serious because of, the Nigerian medical sector, or the Nigerian professionals or doctors, maybe they might have mismanaged the situation, and Mr. Buhari might have been long dead if actually he wasn't frequenting London for his medical checkup and all of those things. But I'll allow you to take a look into what Femi Adesina said.
Like I said, he always had his medicals in London, even when he was not in office. So it was not about the time he was president alone. He had always had it in London. And then you have to be alive first to get certain things changed or corrected in your country. If he had said, I'll do my medicals in Nigeria just as a show-off or something, he could have long been dead, because there may not be the expertise needed in the country. But he needed to be alive to be able to lead the country to a point where we will have that expertise. So those who glibly talk of going abroad, they don't know that a man needs to be alive first before he can effect a change.
And of course, you have the man there, and controversies have trilled that particular statement. But then before we go into all of that, we have Samuel Atiku with us. He's a researcher, he's a policy analyst and public affairs analyst as well. And of course, he resides in the same UK. So I'd like to ask Samuel this morning, what's your impression of what Mr. Femi Adesina said about the Nigerian health sector, who possibly might have turned the unexpected if actually his late boss, that's Mr. Buhari, has been here. And, he said something very profound to say you have to be alive to really perform as well. And maybe that's why Mr. Buhari will do everything to stay alive, even if it means going to the abroad. You and the same abroad right now. So does that mean the rest of us, or the rest of Nigerians, can manage ourselves?
I think it's important to say that what Oga Femi, the way we call him, had said, again, demonstrate what we've always said about him. Absolutely lack emotional intelligence. You need to be very careful what you say to the public. Remember, the president is, of course, the late president. Condolences to his family. Had been president, head of state, for more than 10 years altogether. Nigeria, if you look at Nigeria's democratic history, how old is Nigeria? if you try to put it side by side with how long the president had been around, it tells a new story. And when we look at the health sector, we are not just talking about that hospital, that man, that doctor that takes care of people in the country. Now, just to clarify, I can assure you that some Nigerians living in the diaspora will rather travel back home to take medical care. I mean, it sounds strange, but at least I've met people that feel comfortable having conversation with doctors that they've presumably they've lived in Nigeria for years. They know their medical history. So they would rather travel from the diaspora back home to actually take medical care. So it has nothing to do with the personnel at all whatsoever. Now, to unpack the problem around Nigerian health system, I mean, the problems are there. If you go to the nearest primary health care center closest to you, it will smile at your face. The problem is everywhere. And the health sector itself is not just peculiar to that clinic, in quotes. It's not just that clinic. We are talking about a whole lot of things. It's a system that encompasses a whole lot of things. I mean, I could break them down. For instance, if you look at the health sector, you are talking about public health intelligence itself. To look at the peculiar disease happening. I mean, we all remember in 2020 when COVID happened. Before then, you remember the Ebola situation that happened around Lagos, and then people had to manage it. The whole work around managing that public health intelligence, it's embedded within the health system. The second thing you're talking about is the prevention and health promotion. You must have been hearing things around STIs, HIV, all the old media attention around that. That's all built into the health sector. You're talking about the protection itself, the environment and occupational safety. When you go to office, you see a whole lot of training that people go through. Those are personnel working in that space, making sure that everybody stay alive. I think what people when people talk about health, people will talk about the access and the service linkage itself, the clinic, the way the clinics are built. You look at the maternal ward, the surgeries, I mean, where you perform surgeries and all those things. They are all embedded. You talk about dentistry, you talk about opticians. So you are talking about a wide range of systems. And so somebody to come out and say, oh, if somebody has been in Nigeria, without clearly explaining to the country what the peculiar sickness or disease that actually the president has been struggling with for years, and just putting everything under a blanket, how will I say, put it in an envelope and dismissing the entire sector as not being capable of handling one man, when that same system had been designed to handle 200 and something million, again raise the question around how emotionally intelligent he is. I mean, he's a communication expert, but one expert better from him. I think he had fan up on, I'll call it, he has actually diverted attention away from the core issues that has happened. He's trying to actually, I mean, he has directed attention to the failure, I'll call it the failure of the president, rather than actually make it a situation whereby at least people could actually mourn him and celebrate his life, if you want to celebrate his life, or objectively criticize him for failings or for his actions and inactions in the past. So I would say that the statement was just not it's just not something that you expect from, and it's, I mean, for somebody that's actually sat in a very I mean he has been up there. I don't expect that from, I'll call it, even a graduate. I mean, a recent graduate that is just coming out and learn a whole lot about communication. You should know how to communicate to people. I mean, it's quite unfortunate.
All right, Mr. Atiku, you are in the UK. Let us take a critical look at the statement, the comments of Femi Adesina. He said categorically that Nigeria lacks the expertise to take care of his former principal, the late President Muhammadu Buhari, that Nigerian doctors lack the expertise. That's what he said, talking about expertise. But we have it on good ground that in the UK, as of December 2023, there are 12,198 Nigerian trained doctors practicing in the UK. I'm not talking about Nigerians who studied medicine in the UK, Nigerian trained doctors who emigrated and are practicing in the UK, 12,198 as of December 2023. So are we saying, do you really believe, Mr. Atiku, that Nigerian doctors lack the expertise to take care of the former president? But that was the major point of Mr. Adesina, that it's only when one is alive, that is when he can fix a nation. The late president had 8 years to have fixed the healthcare sector. Even when he was in office, the first lady, his wife, Aisha Buhari, cried out that the state clinic, Asura Clinic, was in a mess, not functional, coming from the first lady. The president did nothing simply because he wasn't affected, simply because he could always travel to London to be treated. How do you judge this whole situation? Talk about the expertise, claiming that Nigerian doctors don't have it, and the failure of the late president to take any action simply because he wasn't affected like ordinary Nigerians.
I disagree completely with what he has said in terms of when you look at the expertise. It's not just peculiar to the UK. If you go to the US, you will see that most of the doctors, most of the experts that you come across are people that had studied in Nigeria. I'm not talking about diaspora that lived out, that stepped out, just like you mentioned. If you go into the academia and you look at the highest ranked journals in the world, you talk about the Lancet with very high impact factor. If you can publish in Lancet within the medical clinician space itself, you are seen as an authority in the world when it comes to health systems, whether it's public health, whether it's clinical practice, if you go there last, you'll see a whole lot of Nigerians. In Nigeria, doctors practicing in Lutz, practicing in our teaching hospital, publishing world-class research, which combines practice. Because again, for you to publish in some of those journals, you have to you're bringing expertise. You are teaching people procedures, and then you're documenting your procedure, and you are putting it into a paper. That paper goes through intense peer review, meaning that the top journals, clinicians in the world, pick up that paper, they analyze what you've said, they critically review it, they give you feedback, you do this front and back. Sometimes it can run to 5 years, 3 years of intense scrutinizing what you have said before they say, oh, this is actually good for publication. I can assure you that a lot of clinicians, in fact, in all our teaching hospitals, most of them are published. In Lancet, they've published in some of those top journals. That's not in question. Whether their competence is a question. That's not even in context. If you come to the UK, carefully, the NHS system had been designed. I mean, if you walk to any clinic in the UK, most likely you come in contact with a Nigerian, maybe an Indian, maybe somebody from Pakistan as your doctor. That's I mean, it's very rare. In fact, you could read it up. If you take the statistics and then you could talk to people. In the UK, they will say they are doctor, the people they come in contact with. I mean, I can tell you that for free myself. If I take my children or anybody to most likely, if my GP is actually Nigerian and he studied in Nigeria, that's not in context itself. So the question around the expertise of Nigeria is never in question. The challenges we've had in Nigeria is chronic underfunding of the health system. You don't expect somebody trying to practice, trying to actually perform surgery on someone's brain to be thinking about generators. There's no light, there's no infrastructure, there's no way to monitor vitals. The entire equipment system is broken down. That's a big problem, right? If you go to some of those clinics that you're talking about, the roofs are off. I remember working intensively. I mean, about 3 years ago, I conducted series of research around the health systems in Ogun State, very close to Lagos State. Now, for context, Lagos State, Ogun State are seen as the Red Ribbon. They are the best health system that you could get around Nigeria, and then maybe peradventure Abuja. Now, if you go there, and then we try to you see a whole lot of problems. And the problems are not just about the clinician, the frontline health worker, just to put it in context and wrap everything up. The problem has to do with the infrastructure in which they are practicing. I mean, let's look at, for instance, vaccines. How many clinics have cold storage facility, cold rooms to actually store vaccines? We don't even have it. Even if you have it, you don't have power to actually power it, to keep it up. Now, that vaccine is administered to children, and then somebody comes and blame the clinicians to say, oh, it's because of you that this vaccine. No, you can't blame anybody. You have to make sure everything is working adequately for you to see that. That's one. Number two, if you look at even the president himself, you need to go through referral systems, right? You have your own doctors also in Nigeria taking care of you. Whether you like it or not, the president, as it were, has Nigerian doctors taking care of him. And it is through referral systems that they travel abroad to some of these private clinics, and then people just read in and then they perform procedures. So when you see a big man traveling abroad, he's not traveling abroad to go and do the whole test and all those things. Most likely, somebody had diagnosed him, a Nigerian, using crude equipment, had diagnosed him, and say, oh, you need to come, you need to do this test, you need to do this test, you need to do this test. We don't have equipment to fix this thing. You need to travel abroad to take this test. And this procedure, you need to do it, you need to do it. Most times, their doctors travel with them. If you look at the president, the late president, most times his Nigerian doctor is always traveling with him to some of those clinics to actually, acting as consultant. And it's not just peculiar to him, it's virtually all the big men in Nigeria that can travel abroad. That's what they do. So the expertise of Nigerian clinicians, frontline health workers, is never in question. I know that for a fact. I've seen that happen. And then if you talk to virtually everybody living in the diaspora, they will tell you about this. In fact, there was an argument on social media at some point that people were saying Nigerian health system was even better than the UK health system. You can look at it on Google. It was a front and back. People in diaspora saying that, and then people in Nigeria are countering that. So it has nothing to do with the expertise. The problem with Nigerian health system had to do with a whole lot of things, and we could unpack it. But the unfortunate truth is that despite the fact that we keep doing problem analysis, we keep identifying these problems, no adequate funding had gone to fixing it. Remember during COVID, when people died because they could not travel abroad, people thought, oh, that would be the golden bullet that would change everything. But here we are, 5 years after, we are still back in the same hole where funding is very limited. Look at this year's budget. How much have we voted for health? And how did we even distribute the funding for health? We just specialize of health workers and throw them to the field, throw them under trees to go and treat people without equipment in this world. That's bad. So again, I reiterate, it has nothing to do with the competence of and the experts that we have in the country. In fact, I feel that we have so much expert that the world sees through us, and attract them and actually steal them away from us. And that's what is happening across the world now.
Oh, all right. Now, so many things to really unpack there. Now, you made a point in your first submission, Samuel, where you said that there are instances in which even some of those people in the diaspora, like yourself, would prefer to come back home, to be consulted and be treated by the Nigerian doctors because of the fact that they believe them and the fact that they have a history and relationship, which really matters. Now, can't that be explained to why the former president will prefer to go to his London doctors and hospitals because of history? Femi Adesina, even while they were in power, or Buhari's media assistants have always said, and that was the point Femi Adesina reiterated, that he has always been, going to London hospitals and being treated by his London doctors even before he came into power. And so why will that change? Because he's just the president and he can't afford to play to the gallery. In fact, it will take somebody that is alive to do the work. Can that be explained? Are we not being too harsh? Because it didn't just start as a president. According to those explanations, he has always been to London hospitals, and so his 8 years in power shouldn't really change that. Relationship, medical history, trust, doesn't that count in this kind of conversation?
If that's the argument that Femi Adesina had presented, to say that, oh, his clinician that had been working with him for decades had relocated abroad because of his failure as a president to pay him what he should pay him, and because of that, I need to travel. But I think that would have been a better argument. The way he has portrayed it is to say that the people that have decided to stay in Nigeria, despite the fact that they are poorly paid, despite the fact that they had infrastructure challenges, despite the fact that they don't have access to the necessary training that they should ideally be getting on a routine basis, despite the fact that their family are disadvantaged, especially for those working in very rural area with very limited, I'll call it public services, that those people are incompetent because they've decided to continue to stay in Nigeria. That's the biggest level of insult that you can mete out to those, I'll call it those heroes of the country, that they are celebrated around the world. If you see doctors here in the UK, they are celebrated. If you go across the US, you see how they celebrate doctors. If you go to Germany, they celebrate doctors. If you go to France, they celebrate doctors. But for the spokesman of the president to look at the face of people that are in Nigeria against all odds, right? Despite the fact of the, I'll call it enormous attraction that they would have actually jumped ship and travel abroad to go and work there and earn more money, put their family in better condition. They decide to stay in the country to continue to treat people, and you look them and say, oh, because you have done that, you are incompetent. That itself is actually disheartening, to say the least. Now, I agree that yes, you could say because of history, medical history, and then because of the condition, I'll call it the kind of ailment that the president is going through, you need to travel abroad because this person has been working on you for a long time, for 20 years, for 30 years, ABC, because of that. Even at that argument may not hold. I will tell you why. The president, the former president, the late president, has been in public service all his life. Remember, he was in the military, and within the military, you are not allowed to travel abroad to go and seek medical help. So when he was in the military, definitely, the physicians, the doctors are within the are within Nigeria to check you. Now, after that, of course, he perpetrated the coup d'etat, took over government, and then became head of state. Again, if you are in Nigeria, public service, the people you're interacting with will most likely revolve around that. And then he was removed. After he left government for a long period of time, maybe during that period, how will I call it now? He decided to, okay, find a doctor, the ailment came in, and then, so that would have been a better argument to present in front of people rather than actually blame a whole block of people that are working tirelessly to keep 200 million people safe and then put them under a blanket umbrella of incompetence because you're trying to defend something that is indefensible.
All right, sir. You talked about the system in Nigeria. You talked about the fact that we don't have cold chain facilities for vaccines. Coincidentally, I happen to have had some experience in that area, having visited majority of the hospitals in Lagos and Ogun State. And I can assure you, I have it on good authority, that none of them actually have cold chain facilities. Most of these vaccines, not most, all these vaccines have to be stored in cold chain between 2 degrees centigrade to 8 degrees centigrade, and they don't have the facilities. Very few private institutions in Nigeria have cold chain facilities, so they have to transport the vaccines using ice packs. Most times when they get to the hospitals, to the clinics, if they are not used on time, you see the ice will thaw, and at the end of the day, they are no longer in cold chain. The cold chain is broken, and the efficacy of the vaccines are affected. So this is one big problem. What do you think the government should be doing differently? Because this is a systemic problem. It has to do with funding of these institutions to ensure that they are properly maintained. I had a conversation with the chief medical director of one of the hospitals. I would not like to mention his name now. And he told me that one of his biggest challenge actually is electricity power supply. When we have hospitals that look more like, I don't want to say it now. Sometimes you walk into these hospitals, you walk into emergency rooms, they are ICUs, and you are shocked. There is no electricity supply in an ICU, intensive care unit. Then how are they supposed to take care of these patients? So it has to do with funding. Do you really think the government should have done better in this area? And do you think there can be any meaningful change unless we have legislation to that effect?
Yes, I think you just you hit the, I'll call it, you have hit the nail where it hurts most, really. The biggest challenge we have in the country is that in terms of our policy design, we really do not look at problems and try to solve the problem. We tend to dance to the gallery itself, and I'll come back to that. If you look at the budget of Nigeria, the health budget of Nigeria, I could give you instances. I know in Anambra State, at some point in time, they could not spend money. They returned the money back into the treasury, even when the money is available. Now, and that's not in context, I can tell you 2015, 2016, 2017, 2018, 2019, funds were returned into the treasury. The same in Ogun State. In fact, in Ogun State, I could give you a good example. In Ogun State, working with, I'll call it working with women itself, and then trying to listen to their lived experience. A woman actually had a baby in her tummy, actually died, and then she was going to a health clinic because there was no scanning, and she was going there for almost 2 weeks, and they felt everything was okay until she stepped out of there. Somebody saw her, I think more of a clinician, based on her experience, looked at her face and said, "This woman, you need to go and take a scan, and then go to the private, these small shops that Nigeria set up, because there's problem. We now set up a shop to address that problem." And then she did the scan. Oh, this baby is dead, and all those things. And then she went into operation. They had to exhume and all those kind of things. Now, I can assure you, in Ogun State, at some point in time, some of those scanners were locked in warehouse, just sitting down there. And I can go on and on and on. So it's a combination of the question around we're not funding the health sector well, and even when resources are made available and we procure things, we tend to dilly-dally, right? We are not really looking at the problem we are solving. We're just seeing things as projects. We buy this thing, we purchase this thing, without looking at the implication of what we are doing. Essentially, we are not grifting from a problem and trying to solve solution. And it reflects around us. And that's why sometimes when I see a road that is being constructed, sorry for digressing a little bit, and there's no sidewalk, and elderly people are living around there, the first thing that comes to mind is that elderly people have most times mobility problem. They should have sidewalk, right? They should be able to sit on wheelchairs and move around. But you're building a road and you are not putting them into consideration. Clearly, you are not thinking of a problem. So that's the first problem we have in the country. We do not connect problems, right, to the way we design our policies. And then by default, the outcome that we get doesn't even impact on the citizen, and then trust is broken. That's the first thing. The second thing is, again, we keep misprioritizing things. We put priorities on things that should not be. So if you look at a Nigerian, classical Nigerian politician, I say, oh, health system, the first thing they're thinking about is building a new primary health care center. Put nice aluminum roof on it, paint it, and then take pictures in front of it. That is absolutely not health system. The health system encompasses more than 10 things that you need to do. You need to look at the operational thing, just like you mentioned, how you move vaccines from their storage space to this center where it's administered without it looking its efficacy. How do you keep it cold? How do you keep things? Now, when you look at it, what do you do in that mode? You could get a small keke marua, right, that looks like that is actually having a cold room built into it, and use that to transfer vaccine conveniently, and then people administer it and move it. So definitely you can solve the problem. But the problem is that we don't think deep in how we try. I mean, I would say that, yes, we have our peculiar problems, and the infrastructure, the electricity is not going to be fixed tomorrow. But people will die tomorrow if they don't get these vaccines. In fact, people are dying because they don't get these vaccines. So what solution can we prefer? Yeah, it could be Keke Marua, it could be a small bus that is a cold room, and then powered by this engine, right, that is running, and then we do that. Maybe we are burning diesel, we are burning petrol to keep this thing cold. We need to think in that mode, right? We cannot just continue to think regimentally. Now, we can move away from there and go straight into the entire medical system, right? The entire medicine. The way, if you go to some primary health care center and you see the way drugs are stored, you shake your head, because they are stored in just cupboards. Rats are actually running everywhere, and then you administer that to a patient, and then the patient's situation actually get complicated, and then you turn around and blame the expert. Again, that's a big problem. It's an infrastructure problem. And if you look closely at the policy, right, the policy design, the National Primary Healthcare Development Agency, they have a guideline that says certain things must be met. If you read that guideline, it looks fantastic on paper. You have to do this. But when you go to the field, they are completely disconnected. In fact, at some point in time, I looked at the guidelines, and then I looked at what I was seeing on the field. I was shocked. And then you sit down with the officer in charge of some of these facilities, they're already underworked, they're overworked. Right. And then you speak to them, they keep telling
Samuel,
you this is the problem.
If I may come in here, because of time, and, you know, we have to go for a break, and when we come back, we switch gears. But you mentioned, I mean, I just want to agree with you, that some of these medical intervention, health intervention you talk about, for the Nigerian policymaker, government politicians, is mostly like a project for them, instead of being solution-based, identifying issues and solving it. But they rather take it as being passed in the budget, and you have done a legacy project for yourself, even if that will not be sustained. And we should look into these issues. Many things to really talk about. But just like you said, it's quite insensitive for Femi Adesina to have carpeted Nigerian doctors and facilities as not being able, you know, to cater for the late Muhammadu Buhari. And if he said he could have long been dead if actually he chose to stay here. And, you know, many persons will expect the NMA or the resident doctors to make a statement on these, either they agree with that position or not. But we'll go on a quick break right now. When we return, we'll delve into something different. That is a topic.